Hello and welcome to Round Robin. I'm your host, Robin McCormick with the city's Marketing and Communications Department. And today we're going to talk about back to school, but specifically immunization time. If you have children or if you have relatives with children, it's time to sit up and pay attention. My guest today is Beth Carroll. Welcome, Beth.
Thank you.
And you're a nurse with the Hampton Health Department, and
Yes.
You've been doing this for a few years, the immunization program.
A few years, yes.
Definitely in the double digits, we'll just say that. Quite a bit of experience with school-age kids and immunizations.
Yes.
So what do you tell parents? What do they need to know this time of year? Let's start with the littlest kids entering preschool or school for the first time. What are the rules?
Well, the immunization start at birth.
That's true.
And so the schedules start on the day they're born, and then parents need to know that there are usual times, normal times that their child needs to have vaccines at 2 months and 4 months and 6 months and 12 to 18 months. And then what comes into play right now is the school entry. But it also is required if your child's entering daycare, or Head Start, or any kind of program where they're going to be around other children.
I bet people don't think about that all the time.
Right, and so there are maybe some things that they need if they've been at home and now are entering into some type of a learning program or daycare. Kindergarten, 4 to 6 years old, is the next milestone after those baby shots are done. And then again at middle school, and then things continue on at college age and into adulthood. But right now, we mainly just want parents to know that there are shots your child needs to have to go to school, and now's the time.
Okay, so if I'm not sure, my kid has had some shots, but I know that he or she is entering kindergarten in the fall. What do I need to do? How do I find out what he needs, and how do I get those shots?
Well, the recommendations for school are available at your doctor, at the health department. The schools give those out when you're registering your child for school. There are certain shots that are required in Virginia to go to school versus things that they may have had that are recommended. And all children need shots once they turn 4. Regardless of what they've had done before that with the baby shots, there are new boosters or new vaccines that need to be given at 4 to 6.
So even if you've kept up with that well baby care, you need to get a new set.
Right, and there's ones that have to be done after the age of 4. So if your child's entering kindergarten or a 4-year-old pre-K program, there are shots that they're going to need to have. And those can either be done at your primary care doctor, at the health department, your military clinic. Some walk-in clinics give vaccines, along with doing school physicals. So they may be able to have them done there as well.
Now, I think there's an impression among some people that the health department serves poorer people. Is that true, or can anyone get their shots for their children there?
Anyone can get their shots. There are some clinics at the health department that are dependent on income levels or eligibility, but immunizations is an open clinic. It doesn't matter about insurance, doesn't matter about income, it doesn't matter which city you live in. So the immunization clinic is open to anyone. And any vaccine that's required in Virginia for school is free. Regardless. There are some
something like the flu vaccine, which isn't required, wouldn't necessarily be. But what are the big ones?
The ones required to go to kindergarten are DTaP, diphtheria, tetanus, and acellular pertussis. There's a polio shot, measles, mumps, rubella, second dose, and a varicella chickenpox second dose. Some children, in addition to that, need to catch up on some things that they may not have had or finished as children, like hepatitis B and Hib, Haemophilus influenza B.
Okay. Now, what are some reasons that parents don't keep up with vaccinations or don't vaccinate their children?
Well, some of the reasons we get are about financial reasons. They think that there's a cost involved and don't realize that they can come to the health department and get those vaccines free. So sometimes they've held off because they've lost insurance or they don't have the money at their doctor. Sometimes it's just procrastination, or it's not the most pleasant thing to think about. Shots is not a fun thing to do.
Right,
And so,
right. We as adults tend to put off medical medical
you put that off
like
as long
that
as
too.
you can.
Right, right.
Some parents their own fears about vaccines, and I think it just gets pushed down on the priority list. There's lots of other things to think about. Busy parents, working parents, and shots is just not top on the list until school entry or something is
right. Now there were concerns because of, I guess, the age at which autism developed and the age at which some vaccines were given, that there was a linkage there. But that's been studied, and vaccines, what is the medical belief about the safety of vaccines?
Well, many very large, important studies have been done, dozens of studies on many children. Large-scale studies have been done and have over and over again proven that there is no link between autism and injury from vaccines.
It's just it's a hard myth to clear up, I think, in the minds of people. And it also may be, as you said, shots are not pleasant, so I'm looking for an excuse or a reason not to have to make my child cry for really what isn't very long in most cases.
Right, and I think with autism, until we have real answers of what does cause autism, concerned parents are searching for answers. And when you don't know, it's easy to look towards something that might be a cause.
Right. Okay, so reminder, if you have a child entering 4-year or 5-year school, kindergarten, preschool, you need to go. And should I put it off until, the day before school starts?
No, absolutely not. Unless you like waiting in very long lines. It's just a frustrating experience for everybody. The crowds are much larger, the wait's much longer. And so now, if you haven't already done it, is a good time to come in.
So during the month of August, what are your hours? And maybe you better tell us where you're located.
We're located at 3130 Victoria Boulevard, right at the corner of Algonquin and Victoria.
Right near the Andrews School, right?
Right, by
what used to be a hospital there.
The new school. The clinic is walk-in.
Okay.
The hours are Monday from 1 to 3:30 in the afternoon, and then Tuesday through Friday is 8 to 11:30 in the morning and 1 to 3:30 in the afternoon. You don't need to make an appointment, it's walk-in. It is very important to bring your child's shot record, especially if they've gotten shots at different places.
And that's certainly true of some of our military families who've moved around or people who've just located here.
Right.
Okay.
We can do some searching for records, and there's a statewide database, but not all records are in there. That takes a little more time. So if you have a copy of your child's shot record, it's a good idea to bring that with you and have it all so that we can have the whole picture together. Because we are then giving the shots that are needed for school and signing the child off that they are complete.
What if I don't manage to get this done over the summer and my child shows up at school in the fall, that first day of school, new backpack, all ready to go, what happens?
You will be picking your child up from school. Unfortunately, the children, that's a bad experience for them because they arrive at their school excited, like you're saying, with their new backpack and meeting their friends, and they're taken to the auditorium or cafeteria or somewhere for their parent to come and pick them up. So they're not allowed to go to school until those shots are completed.
Okay. Now, even for parents who remember this when it comes to child starting school for the first time, it's hard to remember that this has to happen again at, what is it, middle school? 6th grade?
The next time, once they enter into kindergarten, the next time they'll be required to have shots will be entry into middle school.
Okay. That's a hard one to remember, although a lot of times the schools will remind you.
Lots of letters have gone out, lots of reminders in backpacks, and sometimes they don't always make their way home to parents, but they've done the calling, the Connect Ed system, so lots of information out there. But the main one for middle school is the Tdap, the tetanus, diphtheria, pertussis booster, is required to go into middle school. There's some other vaccines that become a new list of recommendations for teenagers. But the Tdap vaccine and for girls, the HPV vaccine are the required vaccines for middle school.
Okay. And is there is there a high school list also, or is it at that point you should get a booster, but it isn't a mandate?
Right. There's no requirement for high schoolers unless they're coming into Virginia as a new student. The recommendations for vaccines are national, but the requirements are may be different from state to state. So your older student may be needing to catch up on something that's required in Virginia that they may not have had.
And the requirement piece is what determines what also gets paid for free.
Exactly.
So if there's a recommended vaccine but it isn't mandated, then the health department isn't going to necessarily offer that for free.
Right.
Okay.
Exactly. Some things are, but that's exactly it, that if it's required for school, that's what mandates the funding of it.
Okay. Now, whooping cough has been in the news lately and in some states out west because there have been outbreaks.
Yes.
Does that mean I need a booster? What is the recommendation at this point?
You very well could. The tetanus, diphtheria, pertussis vaccine for adults was not available until 2005. So any adult that's not been immunized since then does not have any pertussis protection anymore. Their last pertussis vaccine was as a child.
Right.
And so that's immunity has worn off. So any adult that has not had Tdap vaccine, and if you got a tetanus booster before 2005, you didn't get the pertussis part because it wasn't available. So any adult needs to have that booster. Because of the outbreaks, the ages have been extended into older adults, people over 65 that before these outbreaks were not necessarily recommended to have that. And it's a one-time tetanus, diphtheria, pertussis booster, and then you continue to get TD boosters after that.
Okay. So is this outbreak also, I mean, this is the one that parents had the most concern about. I think a lot of children were not being vaccinated against.
Right.
You keep calling it pertussis, I'm going to call it whooping cough, but you've got to know both names, I think, in
right.
some ways. And that partly is what's causing it to spread. And there have been actual, I mean, we forget in this country that these diseases cause death.
Yes.
And there have been some very serious cases, and people need to remember that.
That's right, and that, I think that is what happened, that the pertussis part of the old DTP, before we had a cellular pertussis, is just a refined smaller unit. Instead of the whole cell, they use a part of the cell.
Okay.
So that was done because of safety concerns with the whole cell pertussis vaccine, the old DTP. But because of that, we're seeing that the new vaccine was safer, that came out in the 90s, but it also doesn't provide the same long-term immunity.
Oh, so that's where the concerns have come about.
So sometimes there's some trade-offs in finding a vaccine that is safe and effective and balancing, decreasing side effects with making sure we have a high level of immunity from the vaccine.
But typically, if you have been vaccinated, it might at least reduce the severity of that disease if you do happen to get it.
So it's especially important for adults that are around children, especially young children, because as we talked about before, the schedule starts at birth and they don't complete that full schedule of DPT until they are 12 to 18 months. So before that age, they don't have their own immunity. And so Especially if you're around children that are vulnerable, under 2 years old. That's when the disease is most serious, and that's when they don't have their own immunity. And also then if you're around adults that are in a vulnerable position, if their health or
if they're a lot older, can have a
that would have a more serious result from a pertussis case, then you want to make sure that you're immunized. So daycare workers, moms, grandparents, parents, new dads and moms, pregnant women can get immunized after their 20th week of pregnancy, and that's important so that you have that immunity when that little baby first arrives and you're wanting to hug and kiss and hold that baby.
Right. It helps protect the baby, and it also helps protect you should they get something before they're fully immunized.
Right.
Okay, so to recap, you want anybody who's starting school to check their shot record with their doctor, with the health department, and get any shots that they need.
Yes.
6th grade is a big time that people need some boosters, and really adults should look at their protection from pertussis.
Yes.
Any other reminders as we think about immunizations?
Well, it also is a college entry time, so you also want to be looking at your records if you've got someone going into college or military. So the big messages are that, you know, do it now, not wait. We're there waiting to serve and take care of whatever you need.
Okay, and we'll put up the phone number for the health department just in case people have more questions. But you've said your hours, and it's pretty flexible. It's walk-in. You don't have to have an appointment. But again,
Right.
you should bring whatever records you have,
Yes.
whatever records you can pull together.
Come
Okay.
prepared.
Come prepared. Thank you very much, Beth, for joining us. And thank you. This is a very timely reminder. And I know a lot of our audience out there may not be entering a 4-year-old or kindergarten, but a reminder to check your protection against serious diseases, including pertussis / whooping cough. And thank you for watching Round Robin.